how to find gaps in your care and help your patients and your practice from amazing charts. My name is Mark Daybeck. I'm one of the training specialists today, and I will be doing the webinar today for you guys. So today's agenda, we're going to be going over what are care gaps. We're going to give you kind of a quick introduction to what these are and why they matter to your practice. You're going to learn how you can use them in your practice to, address these issues, how you can identify them and using some of our modules that we have. And then we're going to have a question and answer session at the end. Now, if you guys do have questions during this webinar, just please chat them into the chat box and we will answer them at the end. This way we don't have to stop the presentation as we get going here. So what are patient care gaps? What these are just gaps in care for your practice. Your time is limited, and with a lot of things you have going on running your practice, trying to find different patients and how the services that they need, sometimes patients just slip through the gaps. Uh, patients that maybe are due for physicals, that are due for A1Cs. You guys see a lot of patients. It's hard to keep track of who is due for what. Plus, requirements for tracking the quality metrics have now added to that pressure of trying to keep these patients in line. Uh, and there are gaps in time when you haven't seen certain, even high priority patients in your panel. That can hurt patient care. These are patients that need these services and need them done at a specific time. And it also can hurt your financial outlook for your practice. Let's not forget that not only are you guys as doctors, providing a medical service, but you guys are also running a business, and there's a financial aspect to look at as well. So what are the benefits into finding these gaps, finding these patients who need these services and need to come back in? Well, number one, it saves time. And like I said before, your time is limited and you need to maximize the amount of patients that you see, and especially need to target the ones that need to be seen first. And classically you would do this in, these complex reportings through an EHR. You'd have to drill down and run specialized reports to maybe get these things. You need to be able to do that quickly. You need to be able to quickly and easily identify and schedule appointments for the highest priority patients. And that's a key for your practices. These patients are the ones that need to be seen first. And the ability to schedule more appointments can also contribute to additional revenue to the practice's bottom line. The more patients you see, the more money you guys are going to bring in. And you need instant access to this organized data. Um, and if it is organized in this easy to read fashion, it's makes it just easier to see breakdown by diagnosis or developing an appropriate plan when you're seeing these patients. Number two, it leads to better patient care. It's understanding when a patient should come into the office for a visit is important. Patients need services, and the ability to proactive in scheduling these appointments can improve that care. And you can see in the graph here, you can look and quickly see where patients need that care, how many patients in the practice need that service. And we're going to go into kind of how this breaks down a little bit later. Number three, it gives you improved health of your overall population, making sure each patient has that face-to-face interaction, making sure that they're getting those services that they're needed. With the primary provider each year is one undeniable way to close the patient care gap. Before the end of the fiscal year, providers can generate a list of patients who are in need of stuff like immunizations, lab tests, preventative screenings, um, physicals, stuff like that. Um, and to be able to schedule these patients who have not yet been seen. And you also will be able to get a high level look at your entire practice and how you're doing at managing these patients. You can look and see percentage of, oh, hey, here's, you know, I'm not doing so good at managing my diabetic patients or my hypertension patients, but my COPD patients are doing really well. So you can see that at a higher level. So that improves the overall health of your population. Beyond that, too, there's some studies out there. So, per the healthcare IT news, CMS selected one small practice in West Virginia to participate in a 3-year population health management project. So, this practice got really focused on managing the population health and the care gaps. And what they found is wellness visits for the overall population were greater than 80%. 82% of the 65 plus population had an annual wellness exam when they were managing these. Adolescent wellness visits increased by 146%. Breast cancer screenings increased from 42 to 49%. Cervical cancer screenings increased from 32 to 49%. Colorectal cancer screenings increased from 34 to 64%. And the number of unfilled lab orders dropped. And so these are things that, every practice struggles with. I mean, annual wellness visits going up by 146%. That is huge to think about in a practice, especially when you struggle to get patients back to even make a simple physical. This is a way to bring those patients back in. And the thing we all like, faster reimbursements. Using a system to gather and provide quality metrics makes it easier to communicate with third-party reimbursement entities such as CMS or other insurance companies. So there's all these different benefits here. Financial growth. Uh, we love financial growth. It's this is you guys are a business. Focusing on the quality of care and coordinating with providers allows the small independent practice to fully optimize its fee schedule while transitioning to a value-based model. Um, so it's not just, um, you know, um, it's not just, getting these patients in here. It's prioritizing those that, you know, can get you a little bit more revenue. Instead of investing time and resource trying to get paid, the practice just becomes more automated. So it's, now becomes, oh, let's get these patients in. With getting these patients in, you guys are getting a, more reimbursements. And you can also increase revenue by filling your appointment schedule and billing for additional services. Patients come in and they're coming in for a physical and they're going to probably need you're going to need to address other things. So there's this big medical component of why you want to get these patients in, and health reasons you need, but there's also this financial aspect that people should not ignore. So what to look for? Let's take a look at what you actually want to be looking for. You want to prioritize the highest risk patients in your overall population. You don't want to be looking at the patients where you only got 1, 2, or 3 of these things. You want to prioritize patients, your higher risk patients. You want to be able to see that quickly. The CMS Meaningful Measures Initiative identifies the highest priorities for quality measurement and improvement. It involves only assessing those core issues that are the most critical to providing high quality care and improving individual outcomes. So looking at those CMS measures, those clinical quality measures as part of the care gaps helps you prioritize and get those patients in here. And improving these highest priority quality metrics can be directly correlated to addressing care gaps in order to enhance the patient the health of the overall population. Because you're focusing on these CQMs and these care gaps and managing them, the overall health of your population is going to get better. So how do you actually find the high priority patient in cases? Well, you need tools to do this. You need a tool to provide instant access to the comprehensive data about your entire patient panel and develop an in-depth strategy and target the right patients. So again, as I mentioned before, a lot of times you have reporting structures within your EHRs. Some of them are so broad that it's hard to get a meaningful data out of them. You need a tool that's going to quickly analyze that data and give you the focused data that you need to make these decisions. And there are tools out there that can integrate with your EHR system to provide this information easily and identify the patients who need care. So let's take a quick look at a system to identify patient care gaps in action. And we're going to look at what we call in Amazing Charts, population health. So I'm launching our population health module. Let me bring this over here. This population health module is available for most of our products. It is prevalent in both Care Tracker and Amazing Charts. And here we're landing on the dashboard, and the dashboard gives us some quick, easy reports to see. So I can see quickly my chronic patients with care gaps. I got 2,000 patients in this. How many patients are due for a physical exam in my office? Well, I got 3,000 patients that are due for a physical exam in my office. So I have some quick reports on the front end, and then I can break down into our specific care gaps. Now, this is where you saw that little grid earlier. I have a quick grid here, and I can see the amount of patients that make up each of these diagnoses. So I can see how many hypertension patients I have in my office. I currently have 1,465. So I can prioritize them versus maybe my asthma or my CID patients where I have less than 300 of those. So I can look to see where my priorities lie. Now with this module, you can quickly spot where gaps are. So red means I have care gaps. Green means there's no care gaps. So you can see quickly here where my numbers are. Now, if I want to break down and look at different services within these gaps, I just click on the line and it's going to change this side here. And so for this one, I can quickly look and say, oh, how many patients are due for influenza vaccine here? It's 713. Physical exam, 3,028 patients. Let's look at that one. I always like doing this one because I like applying some math here. So I'm going to drill down and look at my patients and my care gaps. So now I have 3,000 patients that are due for physicals. What I always do is look at this as raw data. I go, okay, this is a good list, but I need to narrow this down even further. Maybe I don't want all these patients. I can apply a filter to this list, and then I can say, maybe let's narrow this down by insurance company. Maybe I know Blue Cross or Blue Shield pays me a bit more. I can narrow down to find just those patients. I can do it by group, so I can create a whole group of insurance. So if I want to just narrow down by my private pay insurances, include all those insurances in private pay, I can do that. I can go to visits and appointments, ignore patients with a future appointment booked in the next year. And I can ignore patients seen maybe in the last 2 weeks. So I'm looking for people for physicals. I'm going to ignore patients who actually have an appointment coming up the next year. They're coming back already. I know they're coming back for an appointment. Ignore patients that I've already seen in the last couple of weeks. I've talked to them already, and we're giving them a chance to look at their schedule and call us back. And I can apply these filters and get a more meaningful data set. And you see my number dropped a little bit. And this is a demo database in a real office. It would drop more significantly. So now I have 3,000 patients that don't have an appointment coming up. These patients are not coming back to the office. They don't have any appointments scheduled. So these are patients that we're not going to see again. So here's where we're going to get them back. Now it's all well and good. We can take these 3,000 patients and we can export this list. And I can give this to a staff member. Well, that's not really good use of your time. Remember, there's a whole budget thing involved in this, and your time is money. You don't want to be calling 3,000 patients to get them back. This system can automate those calls. So we can actually robocall this list. And it's very similar to a reminder system. Where a reminder system is reminding patients that already have an appointment, this system can be set up to remind patients who need to make the appointment. Now you think you have 3,000 patients here. If we say an average reimbursement for a physical exam is $100, that's a lot of potential revenue that's left there on the table. 3,000 times 100, you're talking $300,000 right here of patients that are not coming back into my office. That's a lot of lost revenue. And don't think this being a demo database that these results are not typical. I actually worked with an office where we installed this. And when we ran the potential care gaps for physicals due, this practice had over 9,000 patients that were due for physicals that did not have an upcoming appointment. That's almost $1 million in revenue that was just not coming back to the office. It's a good chunk of change to come back in. Even $300,000. That's a lot of revenue. That's a lot of extra equipment that you can buy. That's extra staff that can be hired on to have this. Beyond that, you can use this, we were talking about, using this for just straight medical. I mean, that's great to see dollar amounts, but hey, I need to find we're running a flu clinic. I want to make sure that the patients that are due for flu vaccine are the first priority to get these. So I'm going to look at this report and quickly go, oh, here's all my flu vaccines. These are all my patients that are due for a flu vaccine. Let's have the system call them first and get them in here for this flu vaccine because they need it. And these care gaps will change depending on what you click on. So if I look at my diabetic patients, you see my gaps had changed. I can look, hey, who's due for a hemoglobin? My diabetic patients need to have hemoglobins every 3 months. Well, who's due for it? Well, now I can get them back in here. Instead of, you see thousands and thousands of patients forgetting that, John Smith didn't come in for his hemoglobin this week. Well, he needs that. So this identifies that and lets them come back. It gets them coming back in. And again, this whole system can be automated so that you can look at the report and then start the process to have the system call those patients and get them back for you. This way you're not wasting a staff member's valuable time making phone calls. There's enough of that already. Let the system do it for you. Have the staff member focused on the patients that are in front of their face. So in review, gaps in time when you haven't seen certain high priority patients in your panel can hurt the practice patient care and also hurt the financial outlook of your practice. I told you I had that practice. They were there was $1 million left on the table there. There are major benefits to identifying and resolving these gaps in care, including better patient engagement, getting those patients engaged and coming back and used to it, improved care, knowing who needs these services and targeting them, and financial growth and getting hours back in your day. You're not wasting staff members' time researching this stuff through bulky and complex reports. They're quick, they're easy, and they're targeted. But you need to find the right tool that can work with your EHR to easily provide you with this information and allow you to be proactive in scheduling appointments. So we're going to open this up for questions. To ask any questions, just type in the chat box. I'll be more than happy to answer them for you. And while you guys are typing, if you guys want to get started, want to take a look at this and want a more in-depth tutorial, a one-on-one review, let us know. We can meet with you guys. Our population health module that you saw includes a lot more than care gaps. It includes clinical quality measures, the care gaps, and also includes chronic care management tracking. If you want to schedule one-on-one, you can visit us at amazingcharts.com. Email sales@amazingcharts.com or call us 866-382-5932 and select option number 2. All right, now that I've rambled and you guys probably answered has some questions, let's take a look. So one of the questions is, do we have to build reports or are they already in the system? They're already in there. We have all these reports that are already static in there. There's no having to worry about, oh, how do I build these things? They're there. You can customize which gaps you focus on, but you don't have to worry about actually building them. They're all built in there for you, and they are customizable to a point. It's a great question. No one's got any other questions coming in? I'll give it another minute. Just if you have questions, just type in the chat box. It doesn't look like there's any questions. I don't see anyone typing. So if you do think of a question, if we end the webinar and you go, oh, I wish I would have found out about this, contact us, sales@amazingcharts.com, or call us 866-382-5932. Be more than happy to answer any questions, talk about how this can work for your practice. I want to thank everyone for attending the webinar today. If you do have questions, feel free to reach out to us. Thanks a lot and have a great day.